Hi, can you hear me?
Yes, we can hear you.
Okay, so this is Kiryasha Mudli. My colleagues Zanele Munyai and Yama van Vengat are also with me, and we'll be reporting from the same computer. So our presentation is about reporting serious adverse events.
Please talk louder.
Okay, can you hear me?
Yes, we can hear you, but you sound very softly.
Okay, I'm going to try and speak a bit louder. So
Yes,
this is
go
our
closer to the microphone.
Can you hear me now?
Yes, yes.
So our topic is reporting serious adverse events. As discussed on the slide, the mission of the National Department of Health is to improve health status to the prevention of in health and promotion of healthy lifestyles, as well as to consistently improve the healthcare delivery system by focusing on access, equity, efficiency, quality, and sustainability. Part of the objectives of the National Department of Health is to contribute towards human dignity by improving quality of care. The South African Health Charter states that patients have the right to complain, for these complaints to be investigated, as well as for feedback to be given about the complaint. It is important to note that the adverse event reporting and monitoring system does not depend on complaints of patients only, but it relies on clinicians to be ethical and report adverse events, no matter how insignificant. Something which I'm sure many of us have seen in South Africa is not done very well. Next. So some simple definitions that we need to go through before we carry on with our presentation. An adverse event is any untoward medical occurrence that may present during treatment with a medicine or intervention, but which does not necessarily have a causal relationship with this treatment. An adverse reaction is a response to a medicine or intervention which is noxious and unintended. A response refers to the relationship between the medicine and or intervention, and the adverse event is in at least a reasonable possibility. An unexpected adverse reaction is one in which the nature, specificity, severity, and outcome is not consistent with the applicable product information. A serious adverse event is regarded as any unexpected medical occurrence that results in death, is life-threatening, requires a patient to be hospitalized, or prolonged hospitalization of an existing admission, results in persistent or significant disability, incapacity, or a congenital anomaly or birth defect. The characteristics of an adverse event. The first one is negativity. It must be an undesirable event in which is detrimental to the patient or the healthcare system. The second is patient involvement or impact. It must involve or have a negative impact or the potential to have a negative impact on a patient. Causation. The event is due to some part of the healthcare process, be it by omission or commission, instead of events outside of the healthcare process. For example, the patient's own actions, nature, and progression of disease. Examples of adverse events are drug reactions, transfusion reactions, wrong site surgery, restraint-related injuries, pressure ulcers, mistaken patient identities, or procedure-related events.
Next, we will be talking about how to manage an adverse reaction. Firstly, one needs to identify the incident. There are many different ways to detect a patient safety incident or an adverse event. While the ones we as doctors most commonly deal with are adverse drug reactions or procedure-related adverse events, It is important to be aware of the other ways in which these incidents can be made known. For example, complaints by a patient to the institution, lawsuits, and even medical record review. Number 2, it is important for immediate action to be taken after an adverse event, as it is critical to stop or reduce the harmful consequences of the incident. These actions can include providing care immediately to the people involved in the incident, making the scene or situation safe so that the same event will not occur again, to gather as much information from the staff who were there for the event and to write it down. As when serious adverse events occur, it can be chaotic, and it is important to remember exactly what happened, document it properly, as often with serious adverse events, lawsuits can occur. Right, next we need to prioritize. We're going to prioritize based on the Severity Assessment Code. In order to notify the adverse reaction, we need to notify it correctly. I will be discussing the Severity Assessment Code on the next slide. I will now talk about notification. As I said, in order to notify correctly, this adverse event must be recorded on a patient safety incident reporting form, and in turn, all of these forms must be recorded in a patient safety incident register. Every facility has one, which can usually be accessed via the clerk of the facility. We will be taking you through exactly what must be included in the patient incident form in a short while. It is important to remember that the Severity Assessment Code, Grade 1, must be reported to the district or provincial clinical risk management team within 24 hours. Furthermore, do not forget that one must disclose to the patient what has happened. Do this in simple terms, in a language that the patient is comfortable with, and it's always important to express sympathy. Include the harm that has happened and explain what will be done to ensure ongoing care for the patient. Then explain the process of reporting the adverse event, as well as investigating the adverse event, and that the patient and family will be provided with feedback. Make sure to answer any questions the patient has and to give them the facility's contact details should they urgently need to contact the facility. The healthcare professional involved in the incident should also apologize during this time. As I mentioned, the Severity Assessment Code is a vital part when dealing with adverse reactions. The Severity Assessment Code is a grading system, and it's used to prioritize adverse events, and it is based on the degree of harm suffered. It determines the level of investigation required. Severity Assessment Code 1 means that serious harm or death that is or could be specifically caused by healthcare provided rather than the patient's underlying condition and illness. As I mentioned, it is important that these cases get reported to the district or the provincial office within 24 hours. Severity Assessment Code 2 is one in which moderate harm has been caused, that it could be caused by the healthcare system rather than the patient's own underlying condition or illness. This needs to be reported to the executive management of the facility within a timeous manner. However, the guidelines do not state the exact time. Severity Assessment Code number 3 is where minor or no harm has come about to the patient. Once again, this needs to be reported to the management of the facility, and the guidelines do not state a timeline. This can be accessed on the South African Department of Health under Severity Assessment Code and Adverse Guidelines. And this gives you an example of all the different types of adverse events and the type of severity assessment codes under which they fall. Right, to continue, Steps 5 to 7 apply to the clinical risk management team at the healthcare facility, so we will only be going over them briefly. As the healthcare professional, we resume our roles in step 8 and 9. Every notified incident will be investigated. The clinical risk manager of the facility will write a report which will include the order in which the event occurred, the interviews conducted with the relevant parties involved, including the patient, analysis of the underlying cause by using the system, solutions identified to improve the healthcare system and prevent it from happening in the future. Moving on to step 6, classification. The incident is classified based on 3 classes: the contributing factors, the incident type, as well as the incident outcome. Step 7, analysis. In order to reduce these events from occurring again, the facility needs to analyze the number of adverse events, the type of adverse events, and the number of safety incident case closures in order to make recommendations for change. This data is submitted by the clinical risk management team to the provincial department on a monthly basis. Step 8. Once the recommendations from the investigation are received from the district risk manager team in a severity assessment code 1 or the health facility team in a severity assessment code 2 or 3, these recommendations should be implemented. And step number 9 is learning. The entire point of this reporting system is to improve patient safety by learning from mistakes which have happened. The executive manager may implement new alerts based on the report investigation so as to prevent a similar event from occurring again. The staff of the facility will get feedback. This includes the staff involved or who witnessed the event, as well as the other staff of the facility. It's important not to forget that feedback should be provided to the patient. This can be done by the healthcare workers involved and the executive management of the facility. It is important to tell the patient of the findings of the investigation, what improvements have been made, and once again for sympathy to be expressed. As you can see now, we will have 3 annexures: Annexure A, Annexure B, and Annexure C. Annexure A resolves in or refers to step number 6, classification, and it helps you as the healthcare professional as well as the clinical risk management team to classify the adverse event. Annexure B is about the incident type. One can look here and it will tell you the type or the sub-classification of the incident. Annexure C is with regards to the incident outcome. As I've mentioned here, Annexure A, B, and C is most important for the clinical risk management team.
Okay, so now we're going to be going through what to include when reporting an adverse event. You should include the patient's details, the date and time of the incident occurring, the location that the incident occurred at, the agents involved, which can be the procedure, the medication, or the person, the staff member, which caused the patient's safety incident, the type of incident that occurred, and the outcomes of the incident and resulting actions. The reporter also has to include their name, surname, and designation. On the following slides, I will go through the types of forms that the reporting person has to fill in. It's also important not to forget to fill in other forms applicable, such as your blood transfusion reaction forms, as well as your drug reaction forms. Okay, so this is now section A. So this form is usually filled in by the section managers where the incident occurred.
And here they will include the patient's details such as their name, surname, file number, age, and gender. We also include the name and surname of the staff involved. We can also grade the incidents here, the SAC grading, and the manager will also just include a short description of what's happened at the PSI site. This is section B. This is where all parties involved in the incident, as well as witnesses, will write a detailed description of what exactly happened. It's important to get as many witnesses as possible, as explained by Dr. van Weeghout earlier, as soon as possible, so that the details can be as accurate as they can be. And this is section C. This will also be mainly written by the clinical managers who are involved with the PSI event. Here they will investigate exactly what caused the PSI, the adverse event, and whether it's a drug reaction, transfusion reaction, or a procedure that caused the patient safety incident. Okay, so when reporting a adverse event, it's important that you as a clinician or as a medical practitioner knows who is part of the management team at whichever facility that you work in. So the risk management team, who are part of the seniors at the hospital. Sorry.
Oh, goodness. Okay, hold on.
Apologies, we just lost our slides.
Can you hear us?
Yes, I can hear you.
Sorry, we're just trying to get back. Let's just see. Sorry, we're just experiencing some network issues.
No problem. While you do that, I just need to address few issues here. This is a very important topic. There is an adverse event for drugs. The most common drug that we having an adverse effect is enalapril. So please, when you've got a patient with angioedema, or it comes with sensitivity to enalapril, and you write on the file that the patient is allergic to enalapril, just be aware of completing the form for an adverse event. That forms normally can be obtained from the pharmacy and be submitted to the pharmacy as well. So don't omit that type of document to complete for the adverse event. The other thing which I want to mention for the adverse event is when a patient died, or there is some friction between the patient and the doctor, or whatever it happens in the clinic. I'm talking about our facilities. If something happens, you need to write an incident report. As the doctor here is having on the slide, is that you need to report on the nursing manager or medical manager or whoever senior is there. You need to write the story. Try to your story from the file of the patient to match with your report, which you're gonna do on the form which the doctor showed just a few slides ago, the form that way you explain your story. So try to match that story with the story which you wrote in the patient's file. And this is for your prevention. Don't be afraid to complete this incident reports. It's for your prevention. It's for your protection. Even if the patient initiate court case, this specifically that document is protecting you. Okay, so don't be afraid to complete that incident reports, and don't forget to complete the adverse event of the drugs and any fluids or whatever is you administer to the patient. But keep in your minds is most common drug is enalapril with the patients which present to you with angioedema, and you need to write that document. It's available in the pharmacy, and you communicate with the pharmacist who you give that document to. Sometimes it's to the pharmacy manager, and they proceeded to the correct team from the district. Okay, please continue.
Okay, so we're going to discuss the risk management team. These are people who are part of the senior managers of a hospital or the clinic where you're working at. Them, together with the CEO, are responsible for implementing policies and objectives that are relating to risk management and patient safety. So this comprises of the nursing service manager, who is responsible for quality assurance, complaints from patients, clinical effectiveness, as well as nursing professional conduct. Second, we have the medical managers. So they are responsible for clinical governance, including risk management and professional medical professional conduct, sorry. And thirdly, these are the systems managers. So they are now responsible for health and safety, such as security of the premises, any fire safety issues, management of the estate, so the property, making it patient safe, catering, as well as environmental health and emergency planning. So it's important for each one of us as healthcare workers to know who's a part of the risk management team, so you know who to involve should you be a part of an adverse event. Okay, so in conclusion, now we should be familiar with the process of identifying and reporting adverse events, the scoring of adverse events, as well as the clinical risk management team. It is a passive monitoring system, so we should, as clinicians, be able to anticipate these patient safety incidences and try to avoid them. If we do come across these incidences, we need to know who's, it's our responsibility to know who's in our risk management teams so that we can involve them. And it's also our responsibility to report these adverse events. Usually we rely on patients to report these adverse events, and medical practitioners may not be forthcoming with what happens, maybe because they're afraid of being reprimanded, or they're afraid of being litigated. But reporting adverse events is the only way that we can develop policies and make sure these events don't occur again. The WHO does have some resources on PSI and reporting, so on patient safety incidences and reporting. So we can use these resources just to read up and see what kind of incidences we can report. Thank you. So these are our references.
Thank you so much. We had such a good presentations today and very important topics. Any questions or any comments?
Maggie, sorry, it's Michelle again.
Michelle?
Can I just make one comment from the PTC meeting that we recently had?
Yes.
Another drug that seems to be switched out a lot, and maybe it's for the reasons that you already said about stockouts and things, is dolutegravir back to efavirenz in the district. And at the moment, we're not sure. I think about 800 patients have been switched back from dolutegravir to efavirenz. And if it is an adverse event, we need to know about it. So if you guys come across that in the clinics and it is an adverse event that's occurring, can you definitely fill in those forms, because we want to know what's going on there. Thanks.
Very good point. Thank you. Thanks, Michelle. So very important topics, and especially this second presentation was again on the clinical governance, and very, very important topic. But all the presentations were good today. I'm happy with your participation throughout the case, and I hope you learned a lot. And if you don't have any questions, we can close the meeting. Any questions or comments? I'm giving you a last chance. Okay. All right.
Dr.
Yeah.
Petrova, I
Yes.
just have a question for the PSI team. So with regard, so the last year I was on a trauma call. Simon Brooks was with me, and we had a patient that was quite aggressive towards us. So from the lecture, I understand that even though it wasn't an adverse reaction, it was an adverse incident that we could have made reported.
Reports. Yes, you should have. You should have. You should have gone to the clinical manager or whichever facility you were in, and to do the report, because all these reports go to the PSI team committee, which is in the district, and the committee sits, depends how many cases there is for discussion, and they sit down. I used to be part of that committee because clinicians need to be in that meeting. But recently, because of COVID, we never had such discussions. But I believe that there is a manager in the district who is watching out these reports coming to the district. So you should have done a report about that. Yes,
And so
both of you, including the sisters who were together with you in the team. Whoever was involved in that team should have written a report.
Yeah, okay. So, I mean, we could even report if patients are waiting for too long, for instance, at maternity, where patients come in at 4 o'clock the evening before and are only seen perhaps.
That is also part of, you can do that, but we're shooting ourselves in our legs.
Yeah, okay,
so,
cool, thank you.
I don't advise you to do that.
Yeah, okay, cool, thank you.
All right. Okay, I hope it was beneficial for everyone. We'll see you again. We'll meet again next week. Send your presentations to the Prof. Musa's website, so everything can be checked there, the recording and everything, the presentations, the cases, and prepare the cases for next week. The presenters today. For next week, prepare an interesting case, which we can start with for the discussion. I'll be probably chairing the meeting again next week, so we'll meet again. Have a good day, the rest of the day, and keep safe. That is the first priority in your work now. Goodbye.